I first became interested in medicine because my dad is a doctor, and I would do easy tasks to assist him at his clinic in whatever way I could. With his support and my growing fondness to help people, I decided to investigate this field of study even further to see if I have what it takes to become a healthcare practitioner or a leader in medicine at all. I'm here interviewing Dr. Lovell about what it means to be a healthcare practitioner.
Two types of health practitioners. First, there's a nurse practitioner that goes to nursing school and then gets an advanced degree in nursing. And in some states, they're able to practice independently, like Wyoming. In many states, though, they need to practice under a physician. There's DA. He's a health practitioner as well, he or she. The practitioner has to work under the direction and supervision of a physician at all times. And then there's myself, who is a physician. My current job responsibility is to diagnose and treat every patient that walks in that door to see me. Then you have a lot of other responsibilities. You have administrative responsibilities. You have a lot of paperwork, sometimes legal paperwork that you've got to do. My primary focus is patients as they come in.
What are the skills required to be a physician?
Well, that depends on what type of physician you're going to be. There are several different types. You've got like a radiologist, you've got a general surgeon, and you have internists or emergency room physicians like myself. As a general surgeon, you'd want to have more of hand-eye coordination and the ability to suture, sew, remove, and operate on people. In emergency room, you've got to be able to handle yourself under very stressful situations of life and death, people dying on you, and emergent situations where there's a lot of blood and chaos at times. As an internist, they define that more as an art, as the art of medicine. The best way to describe that would be taking a set of complaints and forming that into a diagnosis and treatment plan, which can be quite elusive. And you've also got to have a certain cognitive ability. You've got to have the ability to know a lot of information and to formulate that information into some type of use. So it's not just being able to memorize things, it's being able to put it together and to make something out of it.
How much schooling is required to become a general practitioner?
Typically, talking about a general practitioner, you're making the presumption you're speaking about a primary care. So you're looking at from anywhere from 4 to 5 years undergraduate, 4 years medical school, which will be 8 to 9 years, and then up to 6 years after that of training. So it can be up to about 15 years.
Well, what is the entry-level salary for this job?
Well, again, it depends on what you're going to be. At entry level, you're usually going on the low end, so it's about $150,000 at a hospital. And if you stay long enough, you'll get raises. But physicians move rapidly in hospitals.
Approximately, what is the salary for someone with 20 to 50 years of experience in this field?
Well, I'm in private practice right now, so you can really set your own salary, and it depends on how much I work, how many patients I see, and how complex their problems are. If I decided to work 5 days a week and see 30 to 40 patients a day, then you can make upwards of $300,000 a year. So there's no set number in this field. It's kind of what you decide you want to do. And then based on that, that's what you do, and that depends on what lifestyle you want.
Schools that offer medical training include, but are not limited to, Boston University School of Medicine, Oregon Health and Science University, Washington University in St. Louis, Stanford School of Medicine, and Harvard Medical School.